I'm Dr. Anna Saylor with Every Chiropractic Center located in Royal Oak, Michigan, and I'm with Dr. Marissa Heisel from Spines and Minds in Hanover, Ontario. And we're talking about making over your medicine cabinet with essential oils. So thank you.
You're very welcome.
So let's talk a little bit more about things that we can do. Tell me a little bit more what we can do for a fever.
Okay. So the first thing to bear in mind is that fevers can be really beneficial for the body. That's something that you would have experienced as well in your practice. But we want to make sure that we're not just trying to break a fever. A fever is something that actually helps the body to burn off the pathogen that it's dealing with. In fact, research these days is saying that even up to about 104 degrees, we want to let a fever go. So what we'd want to focus on with the essential oils is ways to make our children more comfortable if they're experiencing that. Because the hardest part for us as parents is to watch them going through something like a high fever, even a mild fever of 100 degrees for more than a day or two.
Right. It's not the fever, it's that they're uncomfortable and they might not be eating and they just don't feel
They're
well.
pretty miserable, and they can be, which makes it really difficult for us. And so we want to be looking at things that we can do in order to help relieve some of that.
Okay.
Something like lavender is a really calming oil. Okay. So it can reduce some of that sense of angst and irritability that they really get.
Okay.
Rubbing that on their tummy can be great, on the bottom of their feet. If it's an older child, you can put a drop or two in a little bit of water and let them drink it. You can use lavender, and then certainly diffusing it.
Okay.
You'd want to use something that might be a little bit cooling. So you could use peppermint oil and put a little bit on the back of their neck. Again, on the bottom of their feet, just things to help make them a little more comfortable.
So you're not necessarily trying to break the fever, because my analogy is, do you want to cook the chicken at 200 or do you want to cook it at 350?
Right.
I want to cook it.
Right.
I don't want to kill the germs.
Right.
So,
if you know that they are infectious, if you know that there's something going on, you could certainly use some sort of an immune boosting blend just to help their bodies to fight off whatever that pathogen might be. But my focus wouldn't be on just getting rid of the fever.
Right.
So with something like an immune boosting blend, that again is something that can be put on the back of their spine or on the bottom of their feet. It's something that can be taken internally if it's an old enough child, and that would certainly be something safe to diffuse.
Okay, so what helps the immune system then? What kind of blend?
A number of different things will. Clove oil can, wild orange, again, oregano. There are a number of different things that would go into a blend, but every company, and the one that I work with certainly, has a blend that's called a protecting blend that would be useful for dealing specifically with some sort of virus or bacteria.
Okay. And obviously our goal is to prevent the virus in the first place.
Absolutely.
You want to keep your children as healthy as possible. My children get adjusted at least on a weekly basis, if not more than that.
Right.
We keep them healthy and happy.
Right.
So
I was going to say, we definitely want to be adjusting kids when they're sick. There's a belief system that when somebody is ill, they shouldn't come into the office.
Right.
And that's when I think, unless you're literally incapable of getting out your door, if you can come in because it helps your body to recognize and then address whatever that particular illness is that much more effectively and that much more quickly.
Yeah, we say in our office that our immune systems are so strong because we're getting adjusted on a regular basis. We're using the oils. We're doing all the right things that you're not going to get us sick.
Yeah.
But we want to make sure that you're healthy.
I'm asked that all the time by patients. How do you deal with all of these people? And the answer is, I take supplements. I use the oils, I get adjusted, I eat really well. All of those things, I exercise, I don't get enough sleep. But barring that, I do things that I need to do in order to keep doing the work that I'm doing.
Wonderful. So let's talk about a little bit more about pain relief, because obviously we're chiropractors and we see a lot of people come in with very specific things like low back headaches, migraines, a lot of very specific pain related topics. So let's address those a little bit.
So there are specific oils that are really useful. Again, you'd probably want something that can be cooling, because a lot of that pain is due to things like inflammation.
Okay.
Every person over 45 who has pain is told that they must have arthritis.
Well, of course.
And arthritis is a very specific condition that can really only be seen if there's a decrease in joint space. And even then, it's the inflammatory response of the body that causes the pain response, unless somebody has, bone touching bone, which is really end stage. It's very late in the game. It's the inflammatory response in the body. And truly, inflammation in the body is always going to be something that needs to be dealt with, whether it's in joint or in muscle. And so one thing that I'd want to be doing, even though it seems like it's not related, is making sure that the person's system isn't too acidic.
Okay.
You'd want to be switching from an acidic to an alkaline condition in the body.
And how would you do that?
One thing that can be really helpful is just a little bit of lemon oil and water.
Okay.
Lemon is really detoxifying, so it helps with liver function, and it also helps with that acid to alkaline balance.
Okay.
I'd want to really be looking at the health of the digestive tract. So using an oil that's really beneficial for the stomach and for the intestines, something that helps to both decrease inflammation and improve function.
So that's a really interesting thought, where a lot of people come in and they have a back pain and they think it's their back. And we're talking about all the other things that surround that. So affecting the gut doesn't seem so like back pain related, but it is very, very related.
It is.
Okay.
You know, it's not that we're not going to deal with the back pain, but at least in my practice, and I know in yours as well, I'm not just looking at the back pain, I'm looking at the person. And I'm looking at the whole person. Mm-hmm. And we need to deal with the inflammatory condition that's causing the pain and not just the pain itself. Otherwise, we're just going to keep readdressing the pain. Okay. And they're going to keep coming back in with back pain because we still haven't dealt at the root cause. Yes. We need to look at those root causes these days in healthcare and say, what can we do in order to start to affect change in those? Okay. You know, if we're dealing with back pain specifically, and we just want to look at that, we want to look at something that's a soothing blend. So something that would have some of the cooling oils in it, like wintergreen or camphor or peppermint. You can find them in a blend often. You know, okay. Companies will blend them specifically. You can also put together your own. For deeper arthritic pain and inflammation, something like black pepper and marjoram and cypress can be really helpful. Several of them actually help to increase circulation to help pull away some of the toxic byproducts that are building up because of that inflammation.
So are you talking about a topical use or an internal use too, or both?
Generally, if you're looking at something like low back pain, I'd want to put something on topically.
Okay.
But again, if I'm wanting to address the inflammatory state of the overall person, I'd want to be looking at something that was for internal use.
And would they do it on a regular basis or more just when they're doing the issue, or just?
If it was topical, it would be just if they were dealing with something acutely.
Okay.
But inflammation is not generally acute. You know, it's something that's going on because of nutrition, sometimes a lack of exercise. Stress will induce an inflammatory response.
And we know stress wreaks havoc on bodies
it
right
does.
now. Yes.
It wreaks havoc on bodies. Mm-hmm. There's a very definite link to about 90% of our chronic illnesses coming from stress. Changes our brainwave patterns, which then changes neurotransmitters in the body. And we need to look at all of that.
And now we're going to take some questions from our audience.
Hi, my grandmother is 95 and she lives in a senior residence. She's still very active and very mentally clear, but she's starting to experience some depression because of her surroundings. Is there anything you'd recommend that would help her to get back to her normal state of being?
So certainly there are a number of things that can be done, and I would look at doing something that's much more multifaceted than just looking at essential oils. You know, as soon as somebody goes into a senior's home, there are a number of different factors that come into play. One of them is potential depression, being out of their own home environment, thrust into an environment that really doesn't feel like their own, and might sometimes even be in partial lockdown. So it can feel like it's very intimidating at times. You're looking at nutritional issues. Not every home, even though they might conform to standards, they might not be offering the most nutritiously dense food, and nutrition in itself can contribute to depression. So I'd want to look at what somebody's eating. I'd want to make sure that their environment feels as much like their own as possible, that a room can be decorated for them. I'd want to make sure that they were being adjusted as well.
Obviously.
Absolutely. I would look at something like supplementation. Is there a multivitamin? Is there an essential fatty acid that really needs to come into play? And then lastly, I'd want to bring a diffuser into that room, into her individual room, and diffuse some of the oils that are specifically used to help with mood. So lavender, which is very calming, or a blend of oils that have more of a serene or sedating effect. I'd want to look at something that was really grounding or could bring in a sense of balance as well. So some of the tree oils are really helpful for that. I'd want to make sure that there was an oil that was uplifting. That might involve some of the citrus oils, grapefruit and lime and wild orange. And I'd want to make sure as well that anything that you were diffusing in there was something that was comforting to the individual that you were using it for, that they were sense that they really enjoyed, and that brought a sense of peace and comfort to them.
You can also teach them about applying it themselves.
Absolutely.
A drop a morning or ingesting certain things. So it really depends on their capabilities too.
It can be really beautiful as well to go in there, you know, if a family member went in there and offered them a hand massage using the oils.
Very
so
nice.
touch, therapeutic touch using the oils can be incredibly powerful.
Wonderful. And now we're going to have another question.
Hi, my question is on MRSA, and you suggested to use oregano oil. I would like to request the amount that you put on the child or person, and where would you put this oil at?
There are a couple of oils that are most commonly used these days for MRSA. As we had talked about, there was a study out of England looking at the use of oregano oil in treatment of MRSA. Generally, that would be done internally. And when you're looking at a bottle of oil, so this particular bottle is a 15 milliliter bottle, and that would have about 250 drops in it. And for therapeutic purposes, you'd only be using 1 or 2 drops at any point. Something like oregano is a really potent and powerful oil. You wouldn't want to be taking that internally, even in water, because it's so strong. And so in that particular case, using a veggie capsule can be incredibly helpful, and 1 or 2 drops would be all that's needed, but multiple times, even every 15 minutes, if there was an acute illness. Now, however, with children, you can't get a veggie capsule into them, and you can't put it in water for them. So there are a couple of means by which to do that. One might be to put a single drop into a little bit of apple juice or applesauce, but potentially an even easier way to do that would be to combine it with some sort of carrier oil, again, something that's pure, and to put it on the bottom of the child's feet. So we've talked about how the skin is the largest organ of the body. The bottom of the feet are the most porous skin, and along the back of the spine would be the second most porous. And so mixing oregano oil into a carrier oil and then applying it to the bottom of the feet or the back of the neck or the bottom of the spine would also be a really effective way.
And it's a little spicy too.
It is a little spicy, and so that would be where the carrier oil would have to come in. And the bottom of the feet might really be the best place for a younger child.
Okay. Thank you for joining us, and I want to thank our guest, Dr. Marissa Heisel, for joining us too. It's been a pleasure, and we'll see you soon.